everybody, it's Katie Lacaz, ship counselor for Cenla Area Agency on Aging. Last time I posted a video, I mentioned that I was going to start posting some informational videos about Medicare. So that's what I'm going to start doing, and today is going to be the first video. So just to let you guys know that today I'm going to be talking about aging into Medicare. It'll be a short, painless video, but hopefully very informational for you if you are currently in that situation and have lots of questions, because I'm sure you do. But if you watch the video and think of any questions that you might have or other topics that might be useful for you or people you know for me to come on and talk about, please mention them in the comments, and I will be more than happy to put together a little short video and post it to answer any questions that y'all might have. So now that that's out of the way, let me tell you who we are. Just get that out of the way. We are a nonprofit agency. We're funded by state and federal government, and we're here simply as a resource center and a counseling center for your Medicare and Medicaid needs. So any questions you might have about your Medicare, we can answer those questions. All right, so let's get started. Aging into Medicare, or Medicare 101, as I like to say, because Medicare can be pretty overwhelming and intimidating when you're first coming into Medicare or switching over, because there's so many different parts and so many options. So hopefully in this video I'm going to clear some of that up for you and answer some of your questions about, all the options that you have. And if I leave anything out, please, like I said, mention them in the comments and I'll be happy to answer them later. All right, so let's start with Part A. What is Medicare Part A? Medicare Part A is your hospitalization, okay? This is the part that you pay into through Medicare taxes your entire working life, okay? So when you turn 65, if you have worked your 40 quarters and you qualify for Medicare Part A, it's automatic, okay? Social Security automatically enrolls you into Medicare Part A when you qualify. You get a card in the mail, a red, white, and blue Medicare card that will have your name, your Medicare claim number, and your Part A effective date on it, okay? This part is free. If you've paid into it, then you don't have to pay a premium for it once you get it, okay? Excuse me. Medicare Part B, as in boy. This is your health care, okay? This part does have a premium of $149. I think it just went up. It used to be $148.50. I think it just went up $1 or so this year. And this part covers your health care. So this part will take care of doctor's visits, lab work, procedures, things like that. Like I said, this one does have a premium of about $149 unless your income is over a certain amount, and then that premium can go up, okay? But it starts out at about $149 a month. This part is not automatic, okay? So when you turn 65, your Part A is going to be automatic, all right? You'll get a card in the mail a couple months before your 65th birthday with your Part A. When you get that card, you want to call Social Security or call us to help you enroll in Part B. Now, there are situations where Part B is automatic, okay? But those are different circumstances. Under normal circumstances, you have to enroll in Part B, okay, because you have to pay a premium on it. So it's technically optional. However, if you don't pick it up and you don't have any other coverage, you will be penalized later on down the road if you ever decide to pick it up, okay? So that's your Part B. Next are your optional parts, okay? So these parts you can choose whether you want to pick them up or not, okay? Now, granted, as far as a drug plan goes, if you opt not to pick that up, it's kind of like Part B, where Later on down the road, if you decide you need it and you go to pick it up, you will pay a penalty for it, okay? But we'll get to that in a minute. All right, so let's talk about Medicare Part C, or as you see on TV, Advantage plans. Let's talk about those, okay? An Advantage plan is an optional insurance that you can enroll into, okay? Most of them don't have a premium, but it is optional. And what the Advantage plan does is it bundles all of your health care together under one private insurance company, okay? So hypothetically speaking, let's say you enroll into a Humana Advantage plan, okay? Whenever you go to the doctor or the hospital or the pharmacy, rather than using your red, white, and blue Medicare card for those services, you're going to use your Humana card, and you're going to use that card for everything, okay? The thing with Advantage plans is they do put you on a network, okay? So you're not, it limits you a little bit in the doctors you can use. You do have to use doctors on their network. They are location-based. So the Advantage plans that are available to you are based on where you live, all right? So if you go out of town and you get sick or hurt, the Advantage plan may not cover as well as it does when you're, in your hometown. Okay. Another thing about Advantage plans is you don't get to choose your own drug plan. Okay. So whatever drug plan comes with the Advantage plan, you have to use that. Okay. For your drug coverage, your medicines. Now, another thing to know about Advantage plans, and my mind just went blank. Copays and deductibles. Okay. So with original Medicare, it's 80-20, which means that your Medicare covers 80%, and then you have a 20% coinsurance that you're responsible for out of pocket for healthcare services. That's original Medicare, okay? There's no cap on it. It's always 20%, so there's no maximum out of pocket, and then it kicks in at 100%. No, it's not how original Medicare works. You pay your 20% for your whole life when you're on original Medicare by itself, okay? If you don't have a supplement, but we'll get to supplements in a minute. Advantage plans carry their own copays and deductibles. Now, they are governed by Medicare, okay? But they get to pick their own copays and deductibles that you pay, all right? So, instead of paying your 20% coinsurance, you might pay a $5 or $10 copay every time you see your regular doctor, as long as they're in network, okay? They carry their own copays for hospitalization as well. So, with original Medicare, you have a deductible of about $1,400 per benefit period. That's every 60 days that you're in the hospital. There is a $1,400 deductible, okay, before your 80-20 kicks in. With an Advantage plan, they set a copay for days spent in the hospital, and it ranges anywhere from $200 to $350 per day for the first round, about 7 to 10 days, okay? And then after that, it's a different copay. So it averages out to be probably a little bit more than your original Part A deductible, but not a whole lot more, okay? One thing about Advantage plans that you get, that you don't get with original Medicare is some dental and vision benefits, okay? Now, it's not dental and vision insurance, okay? It's a benefit, which means that they give you an allowance per year to use towards dental and vision, comprehensive dental, okay? So, typically like an exam or a cleaning, you get one of those per year through an Advantage plan. But if you have to have dental work, you use your allowance, and it's generally about $1,500 a year, and then after that you pay out of pocket. Okay, so that's the dental and vision part of an Advantage plan. So you have to kind of weigh it out. What's more important to you? Using any doctor you want to use, or having those benefits that you get with an Advantage plan that you don't get with original Medicare? Okay, so that is Part C, or Advantage plans. That's an option, okay? Another option is a Medigap policy, or a supplement, okay? These work with your original Medicare. You cannot have a supplement and an Advantage plan at the same time. They do not work together, okay? You can only have one or the other. With a supplement, you have a 6-month window to pick that up when you first age into Medicare. During that 6 months, they cannot look at your medical history to determine your premium. After that 6 months, they can. They look at your medical history, your age, all that goes into how much you pay on your premium, okay? Or they can deny you a policy after that 6 months if they want to. They don't have to write you a policy. But in that first 6 months that you age into Medicare, you can pick up a supplement without being subject to medical underwriting. So it's important to get on the boat with that, okay? Or get on the ball. The way supplements work is they work with your original Medicare, which means that if you go to the doctor, okay, without a supplement and on original Medicare, you pay your 20% coinsurance. With a supplement, the supplement is there to cover that 20% coinsurance, and depending on which plan you choose, it can cover it at 100%, okay? The one I generally talk about is Plan G as in girl, because to me it covers the best. In Plan G, you pay a premium, and it usually starts at about maybe $105 a month, and you meet your annual Part B deductible of about $203 per year. Once you meet that deductible of $203 per year, your Plan G is going to kick in, and it's going to pay your 20% coinsurance at 100%, which means that if you go into the hospital, if you have a surgery, if you have any kind of treatments, even just your regular doctor visits, you're going to walk out of there most likely with a very minimal bill or no bill at all. Okay, and that's the way Plan G works. Now, there are other ones. There's ones where you have copays and ones that cover half of your 20% coinsurance. The thing about supplements is it doesn't matter who you buy it from, okay? They all have to pay. If Medicare covers it, they have to cover their portion, okay? So it's kind of like buying life insurance. When you buy a $25,000 life insurance policy, it doesn't matter if you buy it from AARP or Joe Blow. It's still worth $25,000. The only thing that varies is the price and possibly how easy or difficult the company is to work with, okay? When you purchase a supplement, it doesn't matter who you buy it from. You can choose the cheapest one. It's still going to cover the same as the most expensive plan or supplement, okay? The plans vary. So you have different letters, you know, Plan K, Plan N, Plan G, and so on, and they all cover differently, okay? But they have to cover their part if Medicare covers the service, okay? Next thing I want to talk about is your prescription drug plan, or your Part D, as in drug. This is it's technically optional, okay? But the thing is if you don't pick it up when you age in, and then you decide later down the road that you need it, you will pay a penalty, okay? You can, if you stay on original Medicare, you can choose your supplement. Our office can help you with that if you give us a call. If you're aging into Medicare and you need help picking your drug plan, we can help you with that, okay? We can't sign you up for an Advantage plan or a supplement because we're not insurance agents, okay? We are ship counselors, which means that our services are free to you and we are not selling you anything, okay? We're just here to educate you and help you. Okay, so drug plans do carry a monthly premium. They start at about $7 a month, and then you pay copays for your medications. Simple as that. Like I said earlier, with an Advantage plan, the drug plan is included with the Advantage plan, so you don't get to choose. But if you remain on original Medicare, you get to choose your drug plan, okay? And our office can help you with that. Real quickly, I want to cover the Medicare Savings Program. I'm not going to go into great detail on this, okay, because I can do a whole 15 or 20 minute video on it, but I don't want to do that. Here, I'm just going to brush over it real quick because it's important that when you're aging into Medicare to check and see if you qualify for one of these programs, okay? And we can do that here for you. We can screen you for those programs and help you apply. So the Medicare Savings Program is a program that's funded by Medicaid, but it's governed by Medicare, I believe. And this program can help you pay your Part B premium if you qualify. It is an income-based program, okay? And I'll post a video in the future sometime about the income limits for this program, but I'm not going to do that here today. But it is an income-based program, and it can help you pay your Part B premium, as well as if you qualify, okay? They have a program that even pays your 20% co-insurance for you. But like I said, it's all income-based. So there are programs that will just pay your premium, and there is a program that will pay your premium and your 20% co-insurance. And then you have what's called the low-income subsidy or extra help program. Okay, they're both basically the same. They're both funded by Medicaid. But the low-income subsidy is governed by Social Security. Okay. Now, what the low-income subsidy or extra help program does is it pays your drug plan premium and lowers the cost of your medications. So it's two separate applications, two separate qualifications, two different programs that can help you pay your premiums, okay, and help you with the cost of your medications. So that pretty much sums up everything you need to know when you are aging into Medicare or switching over. Medicare, either you have to turn 65 to qualify for Medicare, or you have to have been on disability, SSDI, for 24 months, okay? Generally, when you're on Social Security disability, you get Medicaid, okay? But when you've been on disability for 24 months, guess what? Medicaid will automatically switch you over to Medicare because it's cheaper for the state to put you on Medicare and let you pay your 20% co-insurance than to continue covering you at 100% on Medicaid. Okay, so there are a lot of things you need to know if and when that happens, and we can help you with that. Okay, so that pretty much sums up everything I wanted to go over as far as aging into Medicare and the important things that you need to know when that happens. And like I said at the beginning of this video, if you have any questions or you think of anything that you would like to hear me talk about, please post it in the comments or send us a message, and I'll be happy to, make a video and tag you, in it so that I can get your questions answered. So, again, Cenla Area Agency on Aging. Our phone number is 318-484-2260. My name is Katie Lacaz. I am a ship counselor here. And we're just here to help you with your Medicare. So if you have any questions or you need help with anything, please give our office a call. We'll be happy to help you. Until next time, have a great day.